As implant dentistry increases the frequency and the use of it, we're seeing more of a clinical problem called peri-implant bone loss or peri-implantitis or peri-implant osteitis. So the first problem is the definition of this terminology. Depending on the reports and the literature that's being reviewed, there's different thresholds for defining this peri-implant bone loss disease. So that needs to be addressed clinically. The second problem dealing with peri-implantitis is knowing the potential etiological factors associated with this. Again, it could be patient-mediated, meaning if patients are potential smokers or past periodontal disease, they're more prone to this peri-implant bone loss as time progresses. Also, at the surgical phase, if there's trauma related to the surgery, bone remodeling, recessions is a potential problem. Grafting in grafted sites is a potential problem. We also have certain concepts of implant designs that would attribute to this potential problem, specifically the macro geometry of the design of the implants being used. Finally, occlusion is a potential problem. It's been speculated that heavier occlusion will potentially lose more bone around an implant. Finally, also one more etiological factor is what we call cement trap. If the clinician chooses to use cement as a main mode of retention for these restorations, cement can be trapped underneath, again causing a foreign body reaction and subsequent bone loss. Now, when we are dealing with these peri-implant bone loss, based on the literature that's available, we have a surgical versus a non-surgical approach. At this early phase, it seems like a surgical intervention would be able to improve and or stabilize this potential problem. However, the non-surgical treatment options seems to be a little bit more unpredictable in the final clinical outcomes. So if and when we deal with these peri-implant bone loss cases, it's critical to evaluate the possible etiological factors, and from that point on, try to speculate what caused it and provide the surgical interface or surgical phase of treatment to hopefully stabilize and slow down the process and maintain the prognosis of the dental implant restoration.